A word about cystoscopies. Yes, cystoscopies. A cystoscopy is when a doctor shoves a camera up your urethra to look around inside your bladder. If you have an interstitial cystitis / painful bladder syndrome diagnosis or suspected, you may get asked to do a cystoscopy. And it might be a good idea just to know if there's any visible damage to the lining of your bladder, because it might direct your treatment protocol. Although most of the time, the majority of people with this diagnosis have normal bladders. So on the other hand, it's not even like that important. But if I had glomerulations or ulcers in the lining of my bladder or any visible abnormalities, I would feel like that it was really important information for my care, and so I think it's an important procedure to get done. Now, the thing to know about it is that when doctors do this procedure to male bodies, when they stick the camera up the male urethra, they always anesthetize or sedate, general anesthesia, knock the person out. For some reason, we can only guess about, they don't think that this is harmful or painful to female bodies, even those female bodies with chronic urogenital pain conditions. I don't know how anyone could put those two things together and not think that shoving a camera up a female's urethra would be excruciatingly painful if they have a urogenital pain condition. To me, that's obvious. But myself included, and I see every day plenty of female people who get this procedure without any anesthetic, local anesthetic or general anesthetic. That is unacceptable. You have a right to not be tortured, and this is torture. There's absolutely no excuse for not sedating or putting a person with a female urethra under anesthesia when they have this procedure. So I think you're in your rights to demand sedation or going under general anesthesia when you have this procedure. If you don't want that and you think you can handle the pain, make sure that they give you a local anesthetic like lidocaine with enough time to have it take effect. The last thing you want is for this procedure to be so excruciatingly painful that it flares up pelvic floor muscle dysfunction and starts that sort of problem, or leaves you with other pain afterwards. I've had 3 cystoscopies. They were all normal. 2 of them I was under general anesthesia. I also had a bladder distension and a capsation installation at the same time. The 3rd time I was in a foreign country. I was in Spain, and I had a cystoscopy, and they just did it to me without any sedation or any anesthesia whatsoever. Like, they didn't even put any lidocaine jelly on the camera or on my skin beforehand. It remains one of the most excruciatingly acute, painful experiences of my entire life, and I've been through a lot of crazy medical things. It was so painful that I actually hyperventilated and fainted on the operating table. And the doctors were like, "Oh, what's wrong? Are you okay?" And I was like, No, I'm not okay. You just put me through so much pain that my brain shut down." Anyway, no one deserves that. No one deserves to be treated like that. If you're a urologist and you happen to be watching this video, you can't do that to people anymore. Female people deserve anesthetic for cystoscopy. Thank you for watching my PSA.